In your Eye on Health tonight, we are talking about headaches and migraines. Some of you may start feeling them a little more frequently. Hopefully not, but if you do, relief may not always need to come in the form of a pill. A clinical trial in the Journal of American Medicine right now suggesting mindfulness may play a role. Tonight, we are joined again by a wonderful guest, Dr. Deepika Kumaresan, Baylor Scott White. First of all, welcome back. It's good to see you again. Talk to us about why do migraines seem to spike this time of year? And I ask you that having literally just seen yesterday a Facebook post from a friend of mine in Florida saying she's been in bed for 2 days because of a migraine. Why this time of year? Tell me.
So right now there are a lot of triggers going on. First off, you have the World Cup. I know there's a lot of stress going on in that area.
Did you say World Cup is a trigger for a migraine? Really?
The stress can definitely bring that on.
Seriously?
And the storms, the change in barometric pressures.
Right.
Okay, and the temperature changes, the humidity. And of course, we are in Dallas, the seasonal allergies.
Yeah.
You know, all of this can form a perfect storm and can trigger migraines.
And it's funny you say seasonal allergies because my son and I both noted this morning that we were out of allergy medicine at the house. Somebody needed to get some. And he said, well, is it allergy season? And I responded with 24/7 now in Texas. It never leaves anymore, right? How can people kind of tell the difference? And this is, well, I even hear it in the office a bunch of times. How do I know if I've got a migraine or a really nasty headache, or is it a sinus issue? How do you separate those?
So usually it's a spectrum. One can become the other in terms like, see, when we are talking about migraine headaches, it's usually spasmodic, it's pulsing, it can be one-sided, it can be triggered by smell, taste, and light. You can be very sensitive to those, and you are going to be more debilitated than just sinus pressure.
Right. I mean, a lot of people need to get in a dark room and put a mask over their eyes and have like no outside influence kind of thing. And it's, I've had headaches, you know, just like every common person. I don't think I've ever had the migraine, and I'm so blessed to be able to say that. But most people might just reach for a medicine. I know there's prescription medicine. I know there's, you know, people will take Excedrin with caffeine in it or something like that. But you want to talk about mindfulness.
Yes.
And the minute you say that, I think quiet and calm, but take me a little deeper other than just what Doug thinks on the surface.
Absolutely. So mindfulness is not about emptying your thoughts. It's about paying complete attention and focusing on how you're feeling in your breath, in your body, and your mind. So when you're zoning into that space, you will notice that there are some triggers which is triggering your migraine. So right now, migraine kind of gets you to that mindfulness space because you want to be by yourself. You want to get into that zone.
Yeah, you're already bowing out, right, of everything.
I know, because most common cause of migraine is stress. So people, when they are in a very stressful situation in their jobs, they tend to get more migraine attacks, and we have studies to prove that. So when I say mindfulness is helping, it's to make sure that you're noting down your triggers. You are doing some sort of breath work so that you're taking in deep breaths before things get out of hand. Because usually the migraine medicines, even the abortive migraine medicines, work right before the migraine has taken over, the prescription ones which your doctors give you.
Right, and this mindfulness thing is something, if I came to your office and I was suffering and I need some help, besides the traditional medicine that I'm going to purchase and take out of a container, the mindfulness works in some cases for some people.
Definitely, because for people, it's very subjective. For people who have the triggers, their number one trigger is stress. For them, mindfulness is the greatest tool. They can actually track their progress. They can see how it's impacting on the days when they are spending some time for deep breath work or just sitting in silence, and getting their nervous system reset actually helps in preventing migraine attacks from happening. So you want to track your triggers. For some, it's just the pollen, it's just the allergies triggering sinus pressure, and that becoming kind of turning into a migraine attack depending on the other triggers which are hitting them.
Right. From the doctor perspective, when do we go, patient X is sitting in front of you, when do we go from, okay, we tried mindfulness, now I think we need to go with traditional medicine? When do we cross into that?
Absolutely. It's all overlapped, right? Mindfulness can only get you to a certain space. It's like, it's a sort of preventative space. It's a wellness space. But when it comes to treatment, you want to contact your healthcare provider so that if things get out of hand, where your over-the-counter naproxen and ibuprofen are not helping, you have tried everything you can. You have used the cold ice packs, and you have done all of that, what you read in your Dr. Google page.
Right.
So,
because it's where everybody runs to.
yes. So then it's about time to contact your doctor.
Awesome. Good talk. I'm so glad I don't have a headache tonight, so you didn't have to do anything for me. I feel good.
Perfect.
I feel mindful at the moment. Thank you. Dr. Deepika Kumaresan, thank you for being here. By the way, you can find all of our Eye on Health segments right now on our CBS Texas YouTube channel. Look forward to seeing you again.